So the president has COVID. About 1,600 people a day in Wisconsin are getting sick with it too, even with 2/3 of the state fully vaccinated. And that's leading you and many of us to ask, are the vaccines still effective? Our Catherine Merck spoke with an expert about some of the science behind the vaccines that are available and shares what doctors are recommending now. Catherine?
It's a good question, and from what I gathered today, the answer is yes. Vaccines still work, and doctors want you to get one or get boosted. The CDC says the BA.5 variant accounts for most of all of the new cases in the country right now. I spoke with an infectious disease expert who told me they've known about COVID mutations for some time now. Even though BA.5 is infecting fully vaccinated people, being up to date on your vaccines still reduces your risk of getting very sick or having to go to the hospital.
They're not rendered useless yet against protecting people against severe disease and death. But when the virus keeps evolving, an update to the vaccine is going to eventually be needed.
Government advisors voted last month that it's time to tweak booster doses to better target the most recent mutations. The local expert I spoke with says we'll likely see some of these vaccine adjustments to the new variants that could develop sometime this fall and winter.
Catherine, thank you. COVID-19 infections are rising in the U.S., including here in Wisconsin. Over the past 2 weeks, 181 new cases were confirmed in Dane County, and 293 cases were reported for every 100,000 people in the area. Health officials say 65 people are currently hospitalized with COVID. Statewide, more than 1,600 COVID cases have been confirmed over the past 7 days. 2 deaths have also been reported, and 472 people were hospitalized in the last week.